mai hoki mai and welcome back to Breakfast. It was 14 to 7. From dentists to dietitians, pharmacists to physiotherapists, more health jobs are being added to an immigration fast-track list to help fill massive staff shortages. Health recruiter Prudence joins us now alongside physiotherapist Oliver Smith, who moved to Aotearoa last year from the UK. Morena korua, thank you both so much for being with us. Prudence, can I bring you in here? Gosh, it's good to be talking to you when we're talking about good news. Good news, great news for this latest announcement by the government.
Oh, it's phenomenal news. It's great, Jenny May. We're just so excited that we can get allied health professionals, anaesthetic technicians, physios, pharmacists. We sent a message last night out to our database to say, hey, good news, you can get straight to residency now.
Yeah, so in terms of that database, how many people are we talking about, Prudence?
Allied Health, we've probably got about 4,000 around the world that can now apply. Physios like Ollie and pharmacists, speech therapists, anaesthetic technicians, across the whole board we're recruiting, so we can really smooth the pathway for them now.
Yeah, I want to talk to you shortly about that recruitment process because you've just been in the UK. We were chatting with you last week. Now you're in Bangkok. But I want to bring you in, Oliver, in terms of what was your pathway to Aotearoa and how long did it take you?
So I started my process kind of November 2021. The process originally took quite a while. The registration board took about 4 months to get my registration through and do all the application. But they've now kind of streamlined that for an express pathway for qualified skilled therapists, but upholding the safety and cultural competencies. So that process is much quicker now. And then regarding the kind of immigration side of things, Prue really helped me with the process, getting the interviews and getting me over to New Zealand.
So in terms of others that you know, Oliver, has there been some frustration with our rules here in Aotearoa? Have there been some that you know of that have hung in there and have waited because they've wanted to come here to New Zealand? Have there been some that have just gone, you know what, this is just too hard, I'm done?
Absolutely. So quite a few friends at home just put the application off for quite a long time because just life gets in the way and 4 months of work takes a decent chunk out of your day. But now the express pathway's in, much more people have registered. And now the great thing the government's doing is putting this on the green list, is giving people the opportunity to come and experience it, but stay for the longer term as well.
Prudence, can I bring you back in here? You're working with the industry here in Aotearoa, and so you must know of plenty of healthcare places that have been desperately trying to get staff, and I'm thinking about Queenstown, I'm thinking about Taranaki as well.
Yeah, absolutely. So all the employers now have the confidence that each medical professional will be able to get residency and come to New Zealand with residency. We met up with just over 150 nurses, allied health, GPs, anaesthetic techs, radiographers in Singapore and the UK last week. Just finished Singapore now, and to go back to them now and say, hey, update, great news that you can get residency in New Zealand. It's absolutely fabulous.
Prudence, you can take the fifth on this if you want, but the opposition parties are calling the government's move far too late and that New Zealand was losing the war on global talent. Do you agree with these sentiments?
In some respects, I think we were a little bit slow. We could have changed the green list in December when we got specialists and nurses on it. So yes, I'm disappointed. I was disappointed and I've been frustrated. And we've had physios who we spoke to last night who said, yes, I'm coming to New Zealand now because I can get residency, straight to residency. So it's good news, but it has taken a bit.
Yeah. Just quickly, we're doing an interview just after 7 o'clock, and I'm wondering about radiation oncologists. Now that this list has been expanded, is there a possibility, because they're desperate in the south for radiation oncologists, is this now an opening for them? Do you have any on your list?
We do. Radiation oncologists are specialists and they have always been on the list. Unfortunately, there's a global shortage of radiation oncologists and New Zealand really has to increase the salaries to compete for them. But Te Whātei Ora doing a good job. Physio Registration Board, amazing job. And I think immigration, we've had visas processed within 20 days to get residency in a country. And it's unheard of to move around the world and get residency in a new country in 20 days. So ka pai, New Zealand immigration.
Oliver, can I bring you back in here just to wrap things up? Did you make the right move by coming here to Aotearoa?
Absolutely. I mean, I've only been here for kind of 9 months, but loving it. Had a chance to travel to South and the North Island already. It's been fantastic.
Yeah, well, we appreciate you being here as well and bringing your skills here. Oliver Smith, physiotherapist, Prudence Thompson. Take care of yourself, Prudence, travelling around a fair bit at the moment, and go well. Thank you both so much.
Cheers. Thank you.